صباح الخير عليكم. Good morning. صباح الخير. زي ما احنا عارفين النهاردة او دلوقتي ان شاء الله هنبتدي نعمل ميتنج وهنتكلم صباحكو عسل، وهنتكلم عن الاندوليفت، وهيبقى معانا دكتور روبرتو اهو وعمل جويننج.
Hello, good morning.
Hello, good morning, Dr. Roberto. How are you?
Very good. I'm very good. And you?
Very good. I'm gonna higher the volume a little bit. Yeah. Okay.
Fine.
Is it okay?
Yes, perfectly. Perfectly.
Yeah. And we're having our audience. They are asking in Arabic about Endolift. I have several requests from yesterday that we're going to be translating what we're saying in Arabic. So I'm gonna be talking with you, and I'm gonna be translating it in Arabic after we finish each question. Do you mind this?
Absolutely fine. Thanks.
Thank you.
And thanks for the invitation. It's a pleasure to be a part of this Endolift World Class program.
Thank you.
We hope to bring cutting-edge developments in aesthetic with you, one of the best and top medical doctors in the world. Thanks.
Thank you. Thank you. Dr. Roberto, as we know, he's a plastic surgeon. And could you please introduce yourself? It's I think it's much better. You know more.
Okay, it's fine. Yeah, I'm a surgeon, and I'm experienced in using medical device. And since 2005, we start to develop the Endolift technique. I'm a medical advisor for the company, the Eufoton company. And in the last 15 years, we are trying to take this technology, this technique in a different level, with a different approach. At the beginning was a strong approach. Now we understand that the effectiveness of the laser is when we use in a very simple, easy, and safe way. So nowadays, probably we reach the best level of Endolift technique of ever.
And technology, yes.
Yes.
For me, I like the Endolift technology so much, and for my patients also, they like it. We're having most probably more than 150 patients for Endolift, and we had very great results. That's why the patients are always, and it's a new technology here in Kuwait market and the Middle East as well. So they wanted to know more and more about the Endolift, and since we are the ones who were the first to be entering this technology here in Kuwait, we had to give them more information about this and answer about their questions, which is unknown up till today.
Absolutely.
So we are here today to answer your questions. Let me say that or translate it in Arabic once more again. صباح الخير عليكم. احنا معانا دكتور روبرتو. دكتور روبرتو هنتكلم النهارده على جهاز الاندوليفت. هنجاوب كل اسئلتكم اللي انتوا عايزين تسالوها، وهنتكلم ونشرح لكم اكتر عن الاندوليفت وعن ليه هو متميز، ونتيجة الشد بتاعته بتبقى كويسة، وايه اللي بيفرقه عن الأجهزة التانية الخارجية أو حتى عن الأجهزة الداخلية اللي ممكن تقلده في الماركت. طيب yes, do you hear me all of you please? Because they were asking about the connection and about the voice. ممكن حد بس يطمني ان انتوا سامعيننا كويس والصوت واصل لكم كويس؟ Okay, and I think that we can go on because they can hear us. Okay.
Okay. I can hear you very well and I can see you very well, so it's fine.
Yeah, okay. Okay, from the beginning, could you please describe what's an Endolift technology for the patients, and what does it differ, the Endolift technology, from any procedure which is outward procedure outside the skin? What does the Endolift differs from any other procedures?
Okay, first of all, I want to introduce you the Endolift. The Endolift is a minimally invasive outpatient laser procedure used in endotissal, interstitial aesthetic medicine. And the laser treatment is performed with the latest Eufoton LASEMAR 1500 that is certified and approved by the American FDA for laser-assisted liposuction. And the office-based Endolift technique treatment requires a specific FDF micro-optical fiber that is very thin like a two human hair that enter inside the skin. Inside the skin mean in the superficial or sometimes middle hypoderma. So from there, and the fibers are easily inserted without incision or anesthetic, or maybe use even a little bit of anesthetic, but it doesn't matter, under the skin directly in the superficial hypodermis, creating a microtunnel orientating and along the anti-gravitational vectors. And after the treatment, the fiber are removed. Using this technique, we can obtain a lifting effect, a skin rejuvenation, so a global improvement in the whole area. And the kind of result that we can obtain are really huge, considering the easy technique that we are going to produce. So these are the kind of result that we can obtain, like the before the treatment and after the treatment. So in this case, we have a complete remodeling of the submental area, so in the under chin and the mandibular board. Maybe you want to translate in Arabic now?
Yes, I'm going to do so. Okay. What we're saying here, or what we're Dr. Roberto saying, Dr. Roberto كان بيقولوا عن الاندوليفت دلوقتي ان هو بيبقى عباره عن بروب او حاجه زي الشعره رفيعه جدا بتدخل تحت الجلد وبتبتدي انها تعمل اكتيفيشن للكولاجين، وبتعمل حاجه اسمها ريموديلنج اوف ذا كولاجين، اللي هو بترجع، او ريموديلنج اوف ذا تيشوز، اللي هي بترجع طبقات الجلد تاني زي ما احنا شايفين دلوقتي اهو. بيمشي كفان شيبت اللي هو زي المروحه، بتمشي المروحه دي تحت الجلد عشان تبتدي ترجع تاني طبقات او التيشو لايرز لوضعها الطبيعي. جاي سؤال في النص. If you could please, I have a question for how many sessions did you do for Endolift, and they're asking about the okay, and how long. I've been using the Endolift since November 2019 up till now, and I'm having over 150 cases from Endolift. Could we please return again to our introduction and make, I will ask you please to delay the questions until we finish the introduction, okay? So that we don't interrupt Dr. Roberto while he's giving his session today. بسألكم ان انتوا تأجلوا الأسئلة بعد ما نخلص الانترودكشن. هنديكم انترودكشن الأول أو هنديكم مقدمة عن الاندوليفت، وبعد كده هنسيب لكم المجال ان انتوا تسألوا في كل حاجة انتوا عايزينها. Okay? Okay, could you please continue, Dr. Roberto?
Okay, so the question is when does it start? When I start with the Endolift technique, and
yes,
and so I start the Endolift technique mainly in 2009 with the new technology, with the 1470 nanometer. That is the correct wavelength to treat the water and the fat in the skin. This means that with this technology, we can obtain a tightening of the tissue and a shrinking of the tissue. So why we call this technique Endolift? It's not a lifting.
Yes.
So the tissue doesn't go in this direction. The tissue there is a compactness, a complete compactness of the tissue. This means that is an endo, so means from inside, lifting. So there is a shrinking, a tightening of the tissue. It's not a lifting. The lifting is sure.
Yes, I will translate now. دكتور روبرتو بيقول ان هو عباره عن انا مش بعمل شد للجلد زي مثلا as using the threads or other techniques يعني مش بعمل شد للجلد كده، لا انا بعمل كومباكشن. يعني ايه كومباكشن؟ يعني انا بعمل ضغط للتيشوز او ضغط للانسجه بحيث انها ترجع لوضعها الطبيعي زي في مرحله الوقت اللي احنا كنا فيه اصغر من كده. فانا ما بعملش شد للجلد، لا انا بعمل ريموديلنج، يعني انا بغير او برجع شكل التيشوز زي الاول. اوكي.
Okay. And in the last years, the real the new things is the new fiber that we introduced since 2 years ago in the market, the new ring fiber, the radial tip version fiber. So I mean, at the beginning, when we started to use the Endolift, we're using the same fiber that we are going to use for the laser liposuction. I mean the 200, 300, 400, and 600 microns. And the fiber emit the light just at the top of the fiber. Nowadays, the new fiber that we use mainly for the Endolift, I mean, but it's not exclusively.
Yeah, could you please, Dr. Roberto, I don't want to interrupt you, but could you please save this picture, because I want to explain this picture after you finish it, because many patients are asking about the fibers and about the entrance. So I will stop here and explain it in details, please.
Okay, the flat, the tip version of the fiber emit the energy. See, the tip of the fiber is flat, so the energy is emitted frontally. This is mean that at the beginning can be the only fiber that we can use, but now we are going to use for the Endolift technique this new technology, the fiber. So as you can see, it's like a needle. It's like it's very easy to enter without any anesthesia, sometimes only cooling, with in a unique session. Without any incision, and the energy is emitted around 360, around 230 degrees. There's a radial emission of the fiber. I mean, in this way, you can obtain probably you can obtain a higher tightening effect with a less energy emitted. So, I mean, if there is a risk with the laser, when you use the high energy, it's better to use lower energies. That's why we use the 1470 nanometers, because it's the correct wavelength to obtain with lower watt emitted the best result. So a higher tightening effect respect also the lower wavelength, like the 980, the 1060, or the 1.
Okay, could you please return the picture for the fiber again? Can we see with you the picture for the fiber?
Yes.
So that I can okay. As we can see now, we are دلوقتي احنا شايفين الافيلبل كاليبرز، او احنا عندنا الفايبر ده اللي هو بيبقى عباره عن زي شعره رفيعه جدا. انا هوريها لكم دلوقتي في نهايه الفيديو بتاعنا. بتبقى عباره عن 200 و300 و400 و600. ده النانومتر، ده الويدث بتاعها او التخن بتاعها. بتبقى رفيعه جدا. في ناس كتير بتسال هل هي بتوجع وهي بتدخل تحت الجلد او بتدخل ازاي؟ لا، هي ما بتوجعش، هي مجرد ما احنا بندخلها العيان ما بيحسش بيها خالص. بنبقى حاطين زي انستيزيا عن طريق كريم موضعي بيدخل تحت الجلد، وبيبتدي ان هو يعمل العمل بتاعه، بيبقى ارفع من سن الابره، عشان كده ما بتوجعش. زي ما احنا شايفين، احنا عندنا التيبس بتاعتها مختلفه. ممكن فايبر، زي ما احنا عارفين التيبس بتاعتها مختلفه. في حاجه اسمها راديال فايبر وفي حاجه اسمها فلات فايبر. شايفين الفرق؟ الراديال فايبر لو احنا بنبص مع بعض، الراديال فايبر اللي هو موجود على الشمال بيبقى الانرجي بيطلع منه في ستريت دايركشن، لكن الراديال بيطلع زي فان شيبد او زي مروحه، فبتبتدي توزع ليزر في المنطقه اللي موجوده هنا. طيب we're having a question which I'm asked a lot, whether this fiber or this technology makes fat melting or not.
Okay, If it's needed, yes. I mean, Endolift is a technique that treats only the skin. When in the same area there is also a little bit of extra fat, I mean the double chin, maybe the body areas, but not the mandibular border or not the mid face. So if you don't want to treat the fat, Endolift technique is the best technique, because if you don't want to treat the fat, you just shrink and tie the skin. But when in the same area there is a little bit of extra fat, with the same laser, with the same fiber, changing a little bit the setting, you can also destroy the extra fat. So you can combine the Endolift technique with the laser lipolysis.
Mm-hmm. Okay, then we can use, can we have the 200 please? 200 fiber? Because this one is very thick. This one, I think, the 600. This is the most, the biggest. Okay, and if we want to make fat destruction, we can. But I think to make it clear, it's not mainly for fat destruction. It's for skin tightening, but
Exactly.
little fat destruction will happen. There are many patients who are asking me how to avoid the fat loss here. I don't want to lose fat in the mandibular border. I only want to shrink the tissues or make tightening without losing fat. I like the chubby face, or I like the fat in my face. So I'd like to save them. I don't want them to go.
So it's like that you have two different settings in the device. If you want to do the Endolift, there is an Endolift setting, so not fat melting. If you want to destroy also the fat, you switch the device in the fat melting operative modes, and you can even fat melting the fats and shrink the skin together. So you can combine the two techniques. So in the areas where you want just redefine the skin and lift the sagging skin, you use the Endolift modes. When there is extra fat in some areas, even the body mainly, you can switch also in the fat melting way. So the fiber, while passing through the dermis, there is a FDF micro-optical fiber that act like an intradermal light path and transmit laser energies, offering significant and visible results for sure.
Mm-hmm. Okay, then what we have new now، او احنا عرفنا دلوقتي ان احنا نقدر نغير البارامترز عشان ناخد اللي احنا عايزينه. يعني لو احنا عايزين نعمل فات ديستركشن او فات لوس هنقدر نعمله عن طريق بارامترز معينه. لو عايزين نعمل بس تايتننج نقدر نعمل ده عن طريق الاندوليفت. فاحنا بنتحكم بالبارامترز في النتيجه اللي احنا عايزينها. Okay, and also one of the questions, why does Endolift differs from any other technology which is an outward technology for lifting?
Okay, first of all, the laser in 2006 is certified certified from the American FDA, the Food and Drug Administration, as the best technology to shrink the skin and destroy the fat. So the American FDA approved it in 2006 with the Dr. Chasmodi study from the FDA, from Atlanta Center. This technology as the best technology to combine the fat melting and the shrinking. How? Using this technique in more than 2,000 patients, and they observe that when you use the laser, respect even all the radiofrequency or other easy technique that you can find also in not medical office for sure, you can tight the skin more than the other energies, more than the other activities. So in this way you can work in a very safe and certified way, FDA certified way. I mean, respect the other technology that need maybe a cannula to introduce any radiofrequency or need another device to be used. The simplicity of Endolift is that the fiber that is thin like to hair enter easily inside the skin without any incision or any anesthesia for sure. And if you are in the right plane, the patient don't feel too much. I mean, it's not a pleasure for sure, but it's nothing that you can afford for sure. So the thing is that you have to be in the right clinic. In this way, you can absolutely afford the technique.
Okay. What's Dr. Roberto saying now? احنا هنتكلم هشرح لكم برضه بالعربي ان الاندوليفت بيختلف عن التكنولوجي الاخرى زي ما احنا شايفين دلوقتي اهو في الفيديو. الاندوليفت بيبقى عباره زي الشعره، وده اللي بيفرقه ان هو بيدخل تحت الجلد فبيوصل للتيشوز دايركتلي، غير الاجهزه الخارجيه اللي هي ما بتقدرش توصل للتيشوز الداخليه بالشكل الكافي او بالانرجي المناسبه اللي هي ال 1470 نانومتر اللي بيدخل لهم الدايود ليزر المستخدم في جهاز الاندوليفت. وعشان كده بيقدر الانرجي العاليه دي بتقدر انها تعمل تايتنينج بدون ما تعمل ريسك او بدون ما تعمل اثار جانبيه للحالات. كمان بيقول من المميزات بتاعه الاندوليفت ان زي ما احنا شايفين هي عباره عن فايبر، وانا هوريكم برضو الفايبر اهو. بيبقى عباره عن زي الشعره الصغيره، ده الفايبر، يمكن تكونوا كمان مش شايفينه وانا هقرب لكم الكاميرا اهو. ده الفايبر المستخدم، حاجه صغيره خالص خالص. الفايبر ده هو اللي بيستخدم واحنا بندخل تحت الجلد وبدون استخدام اي كانيولاس. يعني في حاجات كتير او في اجهزه تانية كتير مشابهه للاندوليفت بتفرق الاندوليفت عن غيرها ايه؟ ان هي هنا انا ما بستخدمش كانيولا خالص، انا بستخدم الفايبر فقط وما بستخدمش اي نيدل في ادخال الفايبر، لا انا بدخل الفايبر دايركتلي اندر ذا سكين او تحت الجلد مباشره بدون اي كانيولات وبدون اي الم، عشان الفايبر رفيع جدا زي الشعره، يعني ارفع من الابره. عشان في ناس ما بتبقاش فاهمه يعني ايه زي الشعره، نقصد نقول بانها as thin as a hair، يعني هي في رفع ارفع من الابره. زي ما احنا شايفين دي الفايبرز المستخدمه على حسب المكان، وده الانرجي اللي هو اللون الاحمر اللي بيطلع من الفايبر عشان يدخل تحت الجلد ويبتدي يعمل شرينكج، حاجه اسمها شرينكج، او ان هو يضغط التيشوز عشان يبتدي يعمل ريموديلنج للتيشوز. الاندوليفت بيختلف عن اي جهاز اخر. طبعا كمان اتكلم على المستخدم. الدكتور اللي بيستخدم الجهاز لازم يستخدم او يدخل في الرايت بلان، يعني ادخل في المكان المظبوط عشان اجيب النتائج المظبوطه. لان في ناس ممكن تستخدم اجهزه شبيهه للاندوليفت ولكن ما تجيبش بيها النتائج المطلوبه. ليه؟ عشان انا ما دخلتش في الرايت بلان، عشان ما استخدمتش الفايبر الصح. عشان في ناس هتسالني هو في اجهزه شبيهه للاندوليفت؟ طبعا هتلاقوا في الماركت كتير من الاجهزه هتبتدي تنزل وتقلد الاندوليفت في التكنولوجي، لكن هي مش اندوليفت. فلازم نقدر نفرق الاندوليفت من غيره. الاندوليفت هو كلمه اندوليفت بس، ما بيزيدش عليه ولا حرف ولا بينقص منه حرف. في كتير هتحاول تقلد الاسم او هتحاول تقلد التكنولوجي، لكن انا عايزه انبه جدا ان الاندوليفت زي ما احنا شايفين اهو فايبر بيدخل تحت الجلد. الصناعه بتكون ميد ان ايطالي، هو صناعه ايطاليه وهو FDA approved. FDA approved يعني مصرح من منظمه الصحه العالميه. عشان كده ده اللي بيفرقه، يبقى بيفرق الاندوليفت في استخدامه هو الصناعه بتاعته اللي هو الصناعه الايطاليه مع المستخدم اللي بيستخدم الاندوليفت، ده اللي بيفرق في النتائج، وده كلام دكتور روبرتو. Okay, returning again to our presentation today. They are saying or they are asking about the side effects. One of the questions are asking about the side effects of the endolift.
Okay, it's not mathematical, so there is some side effect about endolift, but everything that can happen after endolift procedure is temporary. That's the first important thing. So I mean, if the selection of the patient is fine and the doctor is skilled, absolutely, and using the right fiber with the correct technique. So I mean, like when you perform any aesthetic procedure, any aesthetic procedure, the percentage is around zero. I mean, not zero, but it's very, very rare to have some problem. The side effects, I mean, that can happen after this kind of procedure can be about 5 areas. The first is the cutaneous and vascular injuries. So, I mean, regarding these two cutaneous vascular, there's almost nothing. I mean, the fiber can enter inside the skin. When enter inside the skin can sometimes remain a small papula, you know, like when you enter needle or when you do the fiber with the treatment for the capillary of the lower limbs. So in a few days, they goes for sure. But usually there's no cutaneous injuries and no vascular injuries. I mean, the fiber is so thin that avoid any vascular injuries. It's not like when you use the hyaluronic, for example, that you have a occlusion risk. For example, I mean, with the laser, with the tissue fiber, you can't. So there's no risk of vascular injuries. Sometimes there is a risk of, nerve injuries, for sure. So this is the main thing that you have to be careful, take care. Sometimes there is a paresthesia or a hypoesthesia. This is the sensitive part of the nerve. So consider the paresthesia or hypoesthesia. It's quite usual to have for a few days, sometimes even for a few weeks, a reduction in sensibility in the area. This is nothing visible, nothing that can create any problem for your social life. So it's something that even after surgery, like breast surgery or a tummy tuck, after any procedure, can be a changing in the sensibility of the area. Very rarely, I never report any hyperesthesia, but there is a paresthesia or a hypoesthesia that is quite easy to afford. Another problem can be the nerve injuries, like the neuropraxia. Neuropraxia, we have to be very careful about this. There are, there's no percentage of these. There are just a few patients worldwide. So, probably the patients worldwide are not more than 10 that is reported to our observation. So it's less than 0.0.0 of the thousands of patients that people have performed worldwide. And considering even this kind of problem can involve that comes quite usually after facelift, for example. We have a therapy with that is a fixed therapy. It's the same therapy that we used after the surgical procedure that can fix the problem. Maybe it needs some weeks, but it's nothing that can be for the life. So any problem that can be for the life. And the last thing that I want to tell you is when we're talking about the fiber breakage. So, some patients are worried, or even some doctors are a little bit worried about the fiber because it's very thin. So what's happening, it's so strong, the fiber, that we can introduce under the skin with safety. So it's important to do this kind of stress test. So the fiber, the thin fiber, you can do 4 or 5 rounds around your finger, so you can be sure that the fiber is very is well built. And I tell you the last thing, that the fiber is single use, and each patient use one different fiber for sure. Maybe you want to complete?
Yeah, please. Okay. What Dr. Roberto is saying here, احنا كنا بنتسأل على اي سايد افكتس او عن اي اثار جانبيه ممكن تحصل للمريض في خلال استخدام الاندوليفت. طبعا زي ما قلنا، اول حاجه بتعتمد على الشقين اللي احنا اتكلمنا عليهم، على ان احنا نتاكد ان ده الفايبر الاصلي الايطالي او المستخدم، ورقم 2 ان المستخدم يكون مستخدم متدرب كويس على استخدام الاندوليفت، لان اي حاجه احنا مش مدربين عليها كويس، او لو حد مش خبره قوي بيستخدم الجهاز، طبعا ممكن يبقى ليه اثار جانبيه زي اي حاجه، زي الفيلرز، زي البوتوكس، زي الخيوط، زي اي حاجه ليها اضرار لو ما استخدمتش بالطريقه الصحيحه وبالجهاز الصحيح. ايه الاضرار اللي ممكن تحصل لو او في بعض المرضى او في قليل من المرضى ممكن انها تحصل؟ زي الابره ما بتعمل مثلا ممكن مكان الدخول ممكن يحصل زي تورم بسيط، او ممكن يحصل زي بروزنج بسيط مطرح دخول الابره. انا شخصيا ما بلاقيش البروزنج ده في حالاتي الحمد لله، لان الدخول الصحيح بالابره بيخلي او بيمنع البروزنج. عشان كده دايما بقول للبيشنتس بتوعي انت تقدري في نفس اليوم تمارسي حياتك طبيعي خالص. حتى لو عندك حفله في نفس اليوم اللي بتعملي فيها اندوليفت تقدري ان انت تخرجي وتروحي الحفله بتاعتك بشكل طبيعي. من الحاجات اللي اتكلم عليها تاني قال ان يعني الحاجات اللي بتحصل في الجلد خارجيا تعتبر لا شيء، يعني مفيش حاجه نقدر نقولها عن الاندوليفت ممكن يكون بيعملش حاجه نقدر نقولها عن الاندوليفت ممكن يكون بيعملها، او زي اثار الابره نفسها. الابره بتسيب بروزنج او بتسيب زرقان، لكن ده خفيف او نادرا ما لما بيحصل ده. مفيش اي اثار جانبيه على الفاسكولار او على الارتريز، يعني الفاسكولار اللي هو الشرايين او كده، ما فيش اي قلق عليهم. لكن ممكن يحصل بعض التنميل، او في بعض الحالات ممكن يحصل تنميل بسيط، وده بيروح مع الوقت في على مدار اسبوع او اسبوعين حسب حاله المريضه. زي ما بيحصل التنميل ده مع اي حالات سيرجريز زي البريست سيرجري، زي ما واحده بتعمل مثلا لايبوسكشن او بتعمل بريست سيرجريز او حاجه زي كده، فبينفع بيحصل زي تنميل بسيط مطرح التخدير ومطرح الانرجي اللي استخدمت في التكنولوجي اللي احنا بنستخدمها. من السايد افكتس الرير قوي او النادر جدا انها ممكن تحصل ان ممكن مثلا حاجه زي عصب يصاب او حاجه زي كده، ودي بتبقى نادر جدا، يقول انها 0.0001 من الحالات. طيب الحالات اللي بتصاب بباراسيزيا او تنميل او النيرف بيتاثر على بسيط، هل بترجع ولا لا؟ دي حاجه تمبرري. طبعا بترجع بعد قد ايه؟ ممكن ترجع بعد اسبوع، اسبوعين، او ماكسيمم شهر. لكن دي بتبقى حالات نادره جدا جدا انها تحصل. ده كان كلام دكتور روبرتو. والحاجه الثانيه اللي بيتكلم عليها السايد افكتس اللي ممكن تحصل عن طريق الفايبر نفسه. عشان كده هو وراكم الفايبر وهو بيتنيه 4 to 5 راوندز او 4 to 5 تيرنز، لفوا على صباعه 4-5 مرات. ده اللي بيفرق جهاز الاندوليفت نفسه او الفايبر المستخدم في الاندوليفت نفسه عن اي جهاز اخر مشابه للاندوليفت. ان الفايبر كمان المستخدم فيه لو هو مش كويس واستخدمنا جهاز تاني، طبعا ممكن ان هو يبتدي يعمل اضرار، لان هو ممكن مثلا لو ما كانش قوي قوي او لو ما كانش جامد قوي ممكن مثلا يحصل اي تلف من الفايبر ده نفسه. فلازم نتاكد دايما ان الفايبر المستخدم هو فايبر الاندوليفت عشان ما يحصلش منه اي اضرار. يعني خلاصه كلامي على الكومبليكيشنز عشان ما توهكوش، هو حاجتين: ان احنا نتاكد ان الفايبر المستخدم هو الفايبر بتاع الاندوليفت الاصلي عشان ما يعملش اي اضرار. رقم 2، المستخدم لازم يكون متدرب كويس جدا على استخدام الاندوليفت عشان ما يعملش اي اضرار او اثار جانبيه. والاثار الجانبيه لو حصلت من المستخدم كويس بتكون بسيطه جدا زي ما اتكلمت عنها، وبتروح في خلال، على حسب اللي انا قلته، بتروح في خلال من اسبوع لشهر ماكسيمم، ويبتدي يستمتع الجلد بالاندوليفت او نتيجه الاندوليفت الجميله. ونخش على الاسئله بعد كده. They're asking about how long does the endolift persist.
How long? Yeah.
How long does the endolift persist?
Okay. Usually there is a one session a year, so that's what we say usually. But you have to see your patient again after 3 months. Then sometimes patient needs after 3 months. Sometimes even after 6 months. So there's no certainly time. It's like when you ask when I have to repeat the Botox, or when I have to repeat the hyaluronic, or when I have to repeat any medical treatment. So each one has his own length in the results. But normally in the middle, you have to consider one session a year. Even if I can tell you that sometimes patient observe an improvement of result even after 1 year. So many patients have a longer effect. And it's quite unusual, but it's very easy for this technique to have this kind of result that is an immediate result also. And there is a middle effect result, and there is a long-term effect result, because different things comes in different time. And so what I can tell you that there is increasing effect in 30, 90 days for sure, but can continue up to 1.5 years, sometimes even a bit more. But the protocol and the stability of the result for sure depends on the biology of the subject treated and the area treated.
Okay. I will translate now. أنا كنت بسأل دكتور روبرتو إن كتير منكم بيسأل الأندوليفت بيقعد قد إيه، أو جلسة الأندوليفت بتقعد معانا قد إيه. جلسة الأندوليفت بتقعد أول حاجة طبعا هي في ليها مينيمم، زي في ليها ميدل رينج زي أي حاجة في الدنيا بتستخدم، زي الفيلر وزي البوتوكس. زي ما بنقول مثلا البوتوكس بيبقى ليه فترة من 4 ل6 شهور، الفيلر بيبقى ليه من 9 شهور لسنة أو لسنة ونص على حسب نوع الفيلر المستخدم. كمان الاندوليفت ليه ميدل رينج، بس هل ده ممكن يتغير؟ طبعا ممكن يتغير على حسب البيولوجي بتاعه الشخص ده نفسه، او حسب التيشوز بتاعه الشخص ده نفسه. يعني لو قلنا في ناس مثلا بتيجي تعمل فيلر وتقول ده انا الفيلر ما بيقعدش في وشي، رحت لكذا دكتور واستخدمت كذا برودكت بس الفيلر ما بيقعدش في وشي اكتر من مثلا 3 4 شهور 6 شهور، رغم ان مثلا في اختي او صاحبتي بيقعد معاها سنه. ده على حسب البيولوجي بتاعك او على حسب التيشوز بتاعتك. بنفرق من شخص لشخص في ان الماده تقعد في وشنا كتير او التكنولوجي يستجيب معانا كتير او لا. بس احنا دلوقتي هنتكلم على الميدل رينج او المتوسط بتاع الاندوليفت، ان هو يقعد في الوش قد ايه او النتيجه بتاعته بتستمر قد ايه. اول حاجه بتمر ب3 مراحل الجلد، اللي هو الايميديت ايفكت، اللي هو الايفكت الفوري اللي بناخده بعد الجلسه على طول. ده العيانه بتشوفه مجرد ما بتنهي الجلسه بتاعت الاندوليفت. There is somebody asking to talk in English. Dr. Roberto is talking in English and I'm translating in Arabic, and I'm gonna repeat again once more for you in English. Okay, no problem. فعندنا immediate result، وعندنا result بعدها بحوالي 30 days، بعدها 30 يوم بيبتدي ياخد تأثير تاني. وفي long lasting effect اللي هو effect مطول بقى، ده اللي ممكن يمتد معاكي بعد لمدة سنة، سنة ونص، وأحيانا بيبقى أكتر من كده. بس كل ده على حسب التيشوز بتاعتك وعلى حسب البيولوجي بتاعت جسمك، هو ده اللي بيفرق من شخص إلى آخر. من الحاجات يبقى احنا قلنا ان هو عندنا immediate results، عندنا ايفكت تاني بيبقى بعد 30 days، وايفكت تاني اللي هو بيبتدي من اول 3 شهور، وساعات بيظهر بعد سنة. تبتدي المريضة تلاحظ ان في فرق احسن كتير في وشها، او واحده مثلا ما شافتهاش من سنه تبتدي تلاحظ ان التيشوز دي عشان يحصل لها ريموديلنج فبتاخد وقت انها ترجع تاني. لكن نقدر نقول ان في immediate results، والايميديت results ده انا شخصيا اقدر اقول ان هو بيبقى بنسبه اكتر من 50% في معظم الحالات اللي انا اشتغلتها. وهوريكم طبعا بعض الحالات اللي اشتغلتها دلوقتي في اخر الجلسه، واكيد دكتور روبرتو كمان هيوريكم بعض الحالات. To repeat it in English quickly, we are saying that there are 3 stages for the endolift. That the endolift could have an immediate result, and it have a result after 30 days, and maybe another third result after 3 months, or maybe this may happen after 1 year. It differs according to your biology and according to your tissues. As anything which have been used, like the fillers, like the Botox, it might have variations. Not every patient is having the same result and the same lasting for the results. It differs according to your biology. This is concerning the longevity of the endolift. Okay.
Very good.
They're saying that could we be using endolift يغنينا عن عملية الشد? Could you replace the endolift instead of surgeries? Could you be using endolift instead of surgeries?
Okay, I mean nowadays maybe when I started 25 years ago, I can tell you not. For sure, the answer was not. But nowadays, we can say that many devices like Endolift, especially in combination with other technique, I mean, when synergy works in the best way, so you can synergize Endolift technique with other technology like a fractional laser or a microfocused ultrasound or radio frequency or anything that you have in your pocket. I mean, that you are able to use. But Endolift is something that cannot be substituted. I mean, it's very unique. And I mean, surgery is not possible to replace the surgery at all. I mean, when surgery is needed, just surgery have to be done. But nowadays, most of patients, I mean, 83% of patients don't want to do surgery. They want to do not they want to do procedure that doesn't involve surgery. This is mean that 83% of our patients, but this is a statistic from the American Society of Plastic Surgeons, where I come from, that says that they don't want a surgery, but they want a result that can be similar to surgery. So using Endolift, and especially Endolift in combination with other technique, we can achieve a result that can be
similar to surgeries.
Yes, absolutely.
Okay. دلوقتي انا كنت بساله على هل الاندوليفت ممكن يغني عن الجراحه، فقال لي زمان كان ممكن ان هو ما يغنيش قوي لان ما كانش فيه كميه التكنولوجيز اللي موجوده دلوقتي دي. دلوقتي استخدام الاندوليفت مع ان العيانه بتبقى ممكن عامله قبلها فيلر او ممكن بعدها تعمل فيلر او بوتوكس او الكلام ده كله، ممكن يغنيها عن الاندوليفت. اذا فاستخدام الاندوليفت تكنولوجي في بعض الحالات، طبعا في بعض الحالات عادي جدا هو يستخدم لوحده، بس احنا بنتكلم على الحالات اللي هي حالات الجراحه، اللي هي الحالات اللي فيها ترهل جامد جدا في الوجه، ودي يعني خلاص في مرحله الجراحه. هل ينفع ان احنا نستخدم الاندوليفت ويدينا نتيجه الجراحه؟ ممكن مع استخدام تكنولوجيز اخرى تديكي نتيجه الجراحه او تديك نتيجه الجراحه، ولكن في معظم الحالات اللي هي ما بقاش فيها ترهل جامد قوي او سكين لاكستي، بقصد سكين لاكستي او ترهل جامد، بقصد اللي هي اعمارهم يمكن تكون فوق ال60، اللي بيبقى فيه الترهل جامد، والترهل ده باين في الوش يعني زي نزول جامد او ترهل جامد، اللي هي بيبقى محتاج قص للجلد عشان الجلد يرجع تاني. هل اقدر استبدل ان انا اقص الجلد عن او اعمل سيرجريز ان انا استخدم اندوليفت؟ ممكن استخدم كذا مره اندوليفت، او ممكن في الحالات دي ممكن استخدم اكتر من مره اندوليفت، او ممكن استخدم اندوليفت مع other technologies عشان اتشيف او اوصل للريزلتس اللي احنا نقصدها. Also Dr. Roberto, we can make more than one session endolift so that we can achieve results which is similar to the surgeries. This is what I'm telling them also.
Yeah.
That for certain cases we can do more than one session endolift so that we can achieve the same results of the surgeries. Therefore, we can give an answer for this, that we can make endolift as instead of surgeries, but according to the case and according to the age, and by using different technologies together, or by using several sessions from the endolift, maybe alone.
Exactly, especially in some areas like the body, you have to plan at the beginning. For example, in the ankle, where you have, as you can see, you want to tight a little bit the ankle in this area, you can have this kind of results. So the tightening and the definition of the area comes from a correct planning of the treatment. In this case, one of my colleagues, Dr. Forte, did a 3 sessions in probably 3 months. So I mean, you can even treat some areas considering a shorter time between the sessions. So each time, each area in the body probably needs a different procedure and have to be customized for sure.
Yeah, I will also show my patients some of the results which were like a surgery patient. This patient, for example, she was going for surgery, and she came and requested for endolift, and she asked me, would I replace the surgery for not doing my surgery and make endolift? I told her that you might need 2 sessions maybe for achieving a result which is similar to the surgeries. And I was astonished, or I was surprised that I had this result from the first session, and she was very happy by this result. For the jowling or the lower jaw, as we can see, that there is very great lifting, as we can see here. I'm gonna be pointing it. Yeah, as we can see here, there is a very great curve before decision and after decision immediately. These pictures are immediately after decision. Yani she has achieved most probably 40%, and still she can achieve more after 3 months, and still she can achieve more after 1 year. So we replaced it with the surgery, and she forgot about doing her surgery. I will translate it in Arabic, please. انا هنا عملت للعيانه دي، كانت جايه هتعمل جراحه، وبعدين قالت لي ممكن ان احنا نعمل اندوليفت ونستخدمه بديل عن الجراحه. قلت لها ان احنا ممكن نعمل، قد تكوني محتاجه لجلستين اندوليفت مش جلسه واحده. وهي وافقت على ده لان هي مش عايزه اي قص في جلدها او حاجه زي كده. فابتدينا ان احنا نعمل لها جلسه الاندوليفت مباشره. النتيجه اللي احنا شايفينها دي مباشره بعد الجلسه حصلت عليها، كانت فرحانه جدا منها وكانت سعيده بيها، واستغنت عن استخدام او استغنت عنها تروح تعمل سيرجري. زي ما احنا شايفين احنا هنا عالجنا كذا حاجه. ابتدينا نرفع الخد من فوق، وابتدينا نرفع اللور جو من تحت والدبل تشين. لو تاخدوا بالكم من فرق الدبل تشين واضح جدا ان حصل حاجتين، حصل فات ديستركشن على الخفيف وحصل معاها tightening of the skin. دي الحاله المبدئيه، دي النتيجه المبدئيه. لسه هتاخد نتيجه ثانيه بعد مرور شهر، وبعد مرور 3 شهور هتاخد نتيجه اكتر، ويفترض انها بعد سنه كمان هتاخد نتيجه اكتر واكتر من كده. اوكي. Okay, I had 3 weeks before. During it, I had too much pain. She's asking about pain. I hadn't think I would get so much pain. I don't know your opinion, but for me, I use anesthesia as a numbing cream before using the procedure.
It's fine.
Before making the procedure, maybe they didn't use for you the right anesthesia or the right timing for the anesthesia, which should be left.
I mean, if the patient feels too much, sometimes it's possible to use anesthesia. It's not that the treatment change in the effect. I mean, so the thing is that if it's needed, you can even use a different kind of anesthesia, like nerve block, where you use it for the barcode, topical anesthesia, a little bit of local anesthesia. In my opinion, it's better to use not a wet anesthesia. I mean, maybe if anesthesia have to be performed, the dry local anesthesia could be performed for sure. Because anyway, the wavelength can short also the water, I mean the liquid, so you can lose a little bit the effect of the treatment, and there is a little bit of spreading of the energy. So it's better to use less anesthesia that is possible. But I mean, it's not a contraindication to use anesthesia for sure. You can even choose the air cooling system. That is a nice thing that you can support for the treatment, but it's not the main topic. I mean, to use the anesthesia or not use the anesthesia. If the patient feels too much, you can use it. That's it.
What Dr. Roberto is saying is that I would talk in Arabic, so because he answered you in English. لما نيجي نتكلم، في ناس كتير بتسأل هل في ألم أثناء الجلسة؟ طبعا الألم احنا بنقول إن هو بيفرق من شخص لشخص. رقم 2 احنا بنحط الكريم المخدر لوقت معين عشان ما يحسش. قد يكون المستخدم اللي يستخدم لك طبعا بره الكويت او بره الشرق الاوسط واضح، المستخدم اللي يستخدم لك بره ممكن يكون ما حطش نسبه التخدير المناسب، عشان كده حسيتي بألم. لكن هو في اغلب الحالات ما بنحسش غير ألم طفيف جدا. العيانين دايما بيقولوا لي او بسمع منهم كومنت ان زي فرقعه اللبان او زي الفرقعه كده، يعني هو احساس بس مش الم صريح او مش حاجه ما تقدريش تتحمليها. يعني نقدر نقول ان ليزر هير ريموفر ممكن يكون مقارنه بيه ممكن ذا سيم، او ممكن ساعات في عيانين بيقولوا لي لا احنا مش حاسين بحاجه خالص، وفي عيانين بيقولوا احنا لما التخدير بيقل شويه بيقولوا لا احنا شويه حاسين بألم، بس ألم محتمل جدا. يعني زي ممكن نقول ألم الفيلرز والبوتوكس واللي هي بتتعمل. في ناس بتقول لا ده مقارنه بالفيلر والبوتوكس ده اقل كتير ألما من استخدام الحاجات او التكنولوجي اخرى اللي ممكن تستخدم خارجيا كمان. يعني في تكنولوجيز ثانيه مقارنه بالاندوليفت ممكن تكون مؤلمه اكتر، يعني مش عايزه اذكر اسم اجهزه معينه، بس في اجهزه ثانيه ممكن تكون مؤلمه اكتر من الاندوليفت. ان جنرال في بعض الحالات ممكن حوالين الفم، هو دكتور روبرتو كان بيقول ممكن يستخدم لها انستيزيا حول الفم عن طريق الابره لما يكون منطقه حساسه زي منطقه حول الفم، فبيستخدم لها عن طريق الحقن يعني. بس هو في بعض المناطق الثانيه لا يفضل فيها استخدام الانستيزيا عشان بتعمل dispersion للانرجي او بتوزع في اماكن احنا مش هدفينها يعني.
And I mean, when you can obtain this kind of result, so I mean, from a lower, so the double chin, you can see here there is a very nice result.
Yeah, it's very
even
nice.
In some areas, like it is one of your beautiful results in the lower eyelids, for sure. That's an amazing result. And also for this area, Dottoressa Migliardi did a festoon treatment after 16 days. You can obtain not something that even with surgery you cannot obtain, or some not easy area like the barcode. For sure, you can obtain for the total rejuvenation of the orbicular part of the face. Or this is one of another unconventional area for sure. The rejuvenation of the ends. This is something that absolutely with surgery you can even consider to obtain. So I mean, there are areas like abdomen that when there is a starting falling, there is a worsening of the area that you can this is a result from Dr. Scrimmali, a nice result just with one session, and this is 1 year treatment. So the result lasts longer if is needed. This is another result for the under chin that is one of the gold standard and best areas that you can treat with the Endolift. I mean, this part, the definition of this part is one of the probably the best area that can be have to be considered to be used.
Endolift, yes. Concerning, please answer which tissues or points must be avoided. We said that the points or the tissues which must be avoided please answer your question. Which tissues or points which must be avoided?
Yeah, I mean, it's not that have to be avoided. The thing is that we have to be careful, like when we perform surgery, for sure. There are in the body, in the face, especially, some dangerous areas. So any doctor that knows the anatomy has to consider these areas because the nerve comes a little bit much superficial. So especially in the face, this is in the manual, operative manual of the laser. So the marionette wrinkle line and the middle part of the neck. So it's not that you have to avoid any area. Is that you have to be careful in the areas for sure.
Yes, yes, and as we said, it differs according to the user. Yani the user must be well trained before using the Endolift because it's not an easy technology to be used by non-trained person. So training for the Endolift and to be having too much cases, this what gives the results much better, or which makes the results much better, and we can obtain good results when we have good information, as what we're gonna be seeing now also. If we're gonna be seeing, I'd like to show you the effect for, sorry, yeah, here. As you can see, this patient, she's a young patient. She's not, because they were asking about the age of the patient, which age could we be using the Endolift. This patient, for example, she's in the 40s and in the early 40s, and she has achieved a very great definition, as we can see, for the cheeks, lifting for the cheeks without fillers, and definition for the lower jaw and for her double chin as well. So which age do you use the Endolift, Dr. Roberto? From which age do you start using Endolift, they're asking?
Okay, there's no age. I mean, in medicine, aesthetic medicine, there are indications. So as you can see, maybe some sport people, they are 20, but it looks like 35, or so there's no age. I mean, when there is a indication, there is a start indication, you can consider to use the procedure. So I mean, no age. That's important.
اوكي then there is no age. ما فيش سن معين نقدر ان احنا نستخدم فيه الاندوليفت، لكن نقدر نقول ان لما الوش بيحتاج شد يبقى هنا احنا ممكن نعمل اندوليفت. يعني لما المريضه بتحس ان في ترهل في وشها ايا كان عمرها تقدر انها تبتدي تستخدم الاندوليفت. They're asking also one of the questions, they're asking about the eyelids. Do you work the endolift for the eyelids and for the upper eyelid as well?
Yeah, I mean the upper and lower eyelids is one of the best area that can be treated with this technique. Mainly the lower eyelids, considering the anatomy for sure, but even the upper eyelids can be considered for the treatment with the Endolift technique. I mean, the first important thing that we have to know is when we consider the anatomy, that the eyelids is one of the easiest and safe area that can be treated. Why? Because differently with the other part of the body, here there is this is you see the eyes. Here there is a muscle, the fat, another muscle, and there is the skin. So I mean, superficially there is the skin attached to the skin, very attached to the skin, that is quite not possible to divide it or separate. There is the orbicularis muscle. Immediately below the orbicularis muscle there is the septum. So when you use the cannula, when you use the fiber, it's not easy to pass through the septum to enter in the fat. This means that when you insert your fiber under the skin, you are under the muscle, and you can find easily the space between the back part of the muscle and the septum. So when you work in the lower eyelids, it's easy to stay in the correct space that is called the space between the muscle and the septum. So and again, when you see the anatomy, as you can see under the skin in the lower eyelids, there's no fat. When you go a little bit lateral and lower, you can see that there is fat. So when you shrink and tie the lower eyelids areas, it's easy to stay in the right plane. So it's one of the easiest areas to obtain a good result and that can be treated. You have not be worried about treat the lower eyelids. I mean, it's not the first area that you are going to treat with Endolift, for sure. I mean, your learning curve have to, maybe after 10, 15 areas in different part of the face, maybe the neck, you can start to work with the lower eyelids. That is one of the best area for the Endolift effect.
Yeah. Then Dr. Roberto saying that كمان الجفون نقدر ان احنا نستخدم لها جهاز الاندوليفت، خاصة لما بننزل تحت الجلد مباشرة بيكون استخدام الاندوليفت سهل في المنطقة دي. كمان لان الناس بيقول الناس كتير بتخاف منه، بس هو مش بالخطورة اللي الناس فاكراها، او بالعكس هو بيجيب ريزلتس كويسة جدا. زي ما وريكم الصور اللي هي بتاعت تحت العين، كان صورة منهم كانت عيانة عندنا هنا كانت واخده ريزلتس كويسه جدا. هنوريكم برضو بعض الصور للعين واخدين ريزلتس كويسه جدا من الاندوليفت، خاصه في منطقه تحت العين. نقدر ان هو نستخدمه في منطقه الابر ايليد، بس النتائج الاكثر او الاوقع بتكون لمنطقه تحت العين. دي الاماكن اللي بيستفاد منها الاندوليفت. كمان من الاماكن اللي بيستفاد بيها الاندوليفت دي this is another patient also for Endolift for the double chin, but I want to show the other areas which could be used. Here is such a great case also, which was the neck. If we can see the neck here, there was redundancy for the skin, not only the double chin. In this patient, the neck and the double chin were treated together, so that we can obtain such a great result. As we can see that there is a fat reduction plus skin quality and the tissues has been changed totally. احنا بنقول ان دلوقتي شايفين كمان المنطقه بتاعه تحت الجلد مباشره اهي، دخلنا عملنا اهو، بيدخل دكتور روبرتو في منطقة تحت العين، بيوريكوا ازاي بيستخدم تحت العين اهو. دخل تحت العين بمنتهى السهولة under the eyes. We can use it easily and it's safe as we can see here. It's under the eye. The fiber is under the eye. As we can see, under the skin. It makes tightening, and also I believe that it lightens the under eye darkness when there is darkness under the. Hello, maybe the connection or something happened. Okay, again we're together. معلش الكونكشن الظاهر حصل فيه حاجة.
Hello, Shahenda.
Hi, Dr. Roberto. I don't know what happened, but maybe
Yeah,
the connection or something.
It's because after 1 hour the Instagram stopped
yes.
all the live, so we have to restart. No problem.
Okay, that's great. Yes, as we were talking about under the eyes, for this patient, for example, she was suffering from the darkness under the eye as well as the wrinkles. As we get closer to the eye, we can see that the hollowness, which is under the eye, is corrected, as well as the color. And the tissues has been remodeled, or we can say that it has a more fresher look for under the eyes. زي ما احنا بنقول، لو احنا شايفين الحالة دي هنلاقي ان تحت عينيها كان فيه سواد كبير جدا اختفى. ده باستخدام الاندوليفت بس. كمان التيشوز او الانسجه اتغيرت تماما، زي ما احنا شايفين الرينكلز البسيطه اللي كانت موجوده تحت العين قلت كتير. مش هنقول انها اختفت، لكن هنقول انها قلت كتير، ودي كانت من الريزلتس الجميله جدا اللي استفادت بيها العيانه لمنطقه تحت العين. لو ناخد بالنا كمان من جنب الحاجب، هنلاقي ان جنب الحاجب اترفع. As we can say, I'm talking about the tail of the eyebrow. It has been elevated with decision. Which makes more space or more lifting for the eyes. Okay.
Very good result. Very good result. Beautiful. Nice.
Yes. Also, we wanted to. They were asking about what other areas could be used. The endolift could be used in.
Okay, we show many different areas that can be even called unconventional for sure. I mean, the main areas, as we say, is the lower third mandibular border, double chin. I mean, nice result we can obtain also in the lifting for the eyebrow for sure. In the wall middle face, that's for the face. The neck is a quite easy area, and nice result comes from the neck. I show you a result from Dr. Ford that it's connected now here.
Yeah, so that's a great result.
Very nice result for sure.
Very nice results for sure.
And another result that for the body, I mean, I show you before the area around the belly button, so the abdominal area.
It was also a very great result.
Very great.
But without any other technology.
Yeah, but one of my favorite that we didn't talk about until now is the inner thigh for sure. Inner thigh is a safe area, and where sometimes just surgery can do something. But when you try the endolift in that area, I mean, it's one of the best.
Which area, sorry?
The inner thigh. The inner thigh. Yeah, the upper part of the inner thigh area.
Yes.
Yes. One of my favorite too is the upper knees. So the area over the knees, where there are many wrinkles that comes for the muscle and skin falling for sure. So you can even support and remodel and smoothing the area using just a 305 micron fiber in that area. And even working in synergy with other treatment, for sure, with other technology. I mean, in the same device attached, when you buy the device, there is also a fractional non-ablative laser. So in all these areas, you can combine, especially in the area where the skin is very thin, like the lower eyelids, like the inner skin, in inner thigh, or on the knees, combined with the fractional non-ablative laser. So in this way, you can work from outside with a fractional non-ablative laser, from inside with the Endolift, creating like a sandwich technique that the combination give the best result that is possible to achieve without surgery, for sure.
Yes. For the areas which is requested too much also is the hands. As we can see here, for example, the hands have been rejuvenated, and also the light it has a lighter color for the skin after making the Endolift. You can see also the knuckles have been changed. It has a great effect also. I like using Endolift also about in the hands. What do you think, Dr. Roberto?
I can see from your beautiful result that I can tell you that it's a very useful area. And in that area, usually I combine the fractional non-ablative laser, for sure. So in this area, my topic is to use the combination of Endolift and fractional non-ablative laser. In this way, the ends can receive a nice and easy, and soft and reproducible rejuvenation without any, I mean, post-operative time. I mean, it's quite immediately the result, for sure.
Yes. What was Dr. Roberto saying is that we can use it. احنا نقدر نستخدم الاندوليفت في many areas او في اماكن كتير. هو بيحب جدا استخدامه كمان في اماكن اسم زي الانر ثاي اللي هي الفخذ من الداخل. شد المنطقه دي بيبقى كويس جدا باستخدام جهاز الاندوليفت. كمان عند فوق الركبه في ناس كتير بتعاني من كرمشه او تجمع في منطقه فوق الركبه، ودي من الاماكن اللي بيستفاد بيها البيشنت من الاندوليفت بشكل كبير وبشكل واضح. المنطقه بتاعت اراوند بالي اللي هي حوالين الصوره او منطقه البطن اللي هي ساعات عند ناس كتير بعد الولاده بتبقى شويه فيها ريدندنسي او كرمشه، بتستفاد جدا من جهاز الاندوليفت. كمان ان استخدامه في الايدين جدا وبيجيب نتائج رائعه مقارنه لاي شيء اخر، مثلا زي استخدام الفيلرز او اشياء اخرى. هو كمان بيقول ان هو بيحب يستخدم الكومبايند او الساندويتش تكنولوجي، اللي هو ان احنا بنستخدم الاندوليفت مع حاجات اخرى زي مثلا استخدام الفراكشنال مع الاندوليفت، بيجيب نتائج كويسه جدا. نقدر ان احنا نعمل الكومبايند تريتمنت دي عشان نحصل على نتائج افضل. في بعض الحالات بنضطر ان احنا نعمل فعلا استخدام 2 تكنولوجيز مع بعض عشان ناخد نتائج كويسه.
I can show buttocks area. Can I show?
Sure.
Okay.
Yes, sure.
For example, this is another patient. Thanks to you that you are doing a great work and beautiful result, and you have a nice and a very professional approach in this technology, and I'm sure in your work. So thanks for your great work.
Yeah, thank you, Dr. Roberto. هو بيشكر كل الديستريبيوتورز اللي عندنا وكل البيشنتس اللي استخدموا التكنولوجي. انا كمان بشكركم، وكنت مستمتعه جدا بوجودي معاكم بالاسئله بتاعت وباجابه دكتور روبرتو بالبرزنتيشن الجديده اللي اتعملت النهارده. وان شاء الله اكيد هنعمل لكم برزنتيشن زي دي كل فتره عشان تقدروا تستفادوا وتعرفوا انفورميشن او تعرفوا معلومات اكتر انتوا حابين تعرفوها. كمان حابه هايلايت في الاخر الاندوليفت هو تكنولوجي زي ما احنا قلنا، زي اي تكنولوجي لو استخدمناه بالطريقه الصحيحه هنلاقي نتائج منه رائعه. لكن اي شيء بيستخدم يعني بتكنولوجي مختلفه او غير او مقلده او المستخدم مش متمرن كويس، طبعا ممكن يبقى ليها اثار جانبيه. لكن اي حاجه بنستخدمها صح وبنتمرن عليها صح بتدينا النتائج اللي انتوا شفتوها معانا في الفيديوهات دلوقتي. وان شاء الله نطور معاكم التريتمنتس اكتر واكتر ونجيب لكم تكنولوجيز جديده وان شاء الله باذن الله في لقاءات اخرى. Thank you, Dr. Roberto.
Thank you to you again. Thank you.
Thank you. And till we meet again, we will arrange it once more again because it was very interesting and useful for the patients, and they gain many information from you. Thank you so much. It was a great meeting.
Thanks so much. Thanks so much.
Thank you. Thank you.
Bye-bye.
Bye-bye. Bye.